Okay, hi everyone. Thank you for joining us today. It is May, which means it is now our May STEM Talks. This month, our STEM Talks is all about nursing. So before we get into housekeeping, I'm just going to launch our usual welcome poll, and you should see that pop up on your screen as a separate window, and I'll quickly cover housekeeping while I leave that up for everyone. So this month's panel is going to feature 3 amazing nurses who work and do research at the University Health Network. They are going to talk about their education and career journeys, and then we will have an open question period. So we ask you please leave off your microphones and cameras so as not to disturb them as they're speaking. And if you have a question, feel free to put it in the chat, or at the end when we are doing the Q&A, you can use the raise hand feature and we'll select you and you can go unmuted. If you are here for the certificate program, we are noting attendance. Just make sure your name is spelled correctly on Zoom and you're using the same first and last name that you used to sign up for our certificate program. I'm gonna leave the poll up for another 30 seconds, but I will pass it on to our first speaker today, Sharon.
Hi, good evening, everyone. I'm Sharon. I am a nurse educator, and I'm very excited to be part of the STEMs talk with you guys today. So like I already mentioned, my name is Sharon Mordovin. My long title of work is Advanced Practice Nurse Educator, but for short, I can just call myself a nurse educator. I cover a couple of surgical areas at Toronto Western Hospital, so the surgical services as well as the shoulder arthritis program. So just a little bit of a background about myself. I was born and raised in Zimbabwe, and then I migrated to Canada around the age of 12 years old. And in terms of like my work background, I have been working at UHN for about 11 years. So essentially, once I graduated from the nursing program, my first job was at UHN. So I've been with the organization pretty much the entirety of my nursing profession. So I just have a couple of pictures up there, just sharing some of the things I love to do. I love to travel, hiking, anything that involves nature, you can count me in. So things like canoeing, hiking, and so forth. I just love just being in nature. I just feel very rejuvenated. So just a couple of pictures I have up there. It's just me just recently in Mexico back in February. So it was just a little getaway from the winter in Canada. And then the picture to the right, so this was last summer with my family on the Amalfi Coast in Italy. So when I'm not at work, I'm definitely getting somewhere, whether it's a car ride to another place or jumping on a plane traveling somewhere else. Again, just as a way to just rejuvenate myself. All right, so in terms of education, so my undergraduate education, for nursing, I received at Toronto Metropolitan University, formerly known as Ryerson. So it is a 4-year undergraduate program. So I did that from 2009 up until 2013. Then I graduated with the Bachelor of Science in Nursing. And then a few years into my career, so about 5 years into nursing, I decided to go back to school to look into my graduate program. So I decided to go through York University, just trying out a different school. There were a lot of opportunities while I was in the program. So I did start the program in 2017. It is a 2-year graduate program. So I completed the education in 2019. So I did graduate with my Master's of Science in Nursing. All right. So as a surgical nurse educator, so like I mentioned before, I cover a couple of different areas. I do see or support staff when we're caring for patients that go through different surgical procedures, so including general surgery, microvascular, hand plastic surgery, urology, orthopedics, and ophthalmology. So this is a wide range of different surgical patients that we see on the 2 units that I support. So I specialize in these areas. So in addition to what I do in terms of supporting staff, there's lots of, just from my title, nurse educator, there's lots of education that I'm involved in and supporting the frontline staff. So yes, I am an advanced practice nurse educator, but I do support staff beyond just the nursing group. So I definitely support nursing students that are coming through our program, like our hospital. So UHN is an academic institution, so we do see a number of students coming through our program. So part of my role is to actually accept these student requests and support the students as they go through their placements with us. I also support personal support workers, clinical externs, which are essentially nursing students, but they come support our staff, kind of functioning kind of like a PSW, so supporting the nursing staff with like getting the patients, up and walking, feeding patients, and so forth. Then I also provide education and support to the interprofessional team. So working in the hospital environment, there's various team members that I work with, from physicians to dietitians, social workers, what have you. So it's a very large team that we work with. And again, part of my role is to support the staff when it comes to anything education or practice related. My line of work also involves it does require me to engage in research, quality improvement. So as you guys can imagine, there's always new research that comes out, and we always need to update our staff with what's best practice. Things do change over time. So part of my role is to make sure that this research is actually translated into practice, and any sort of quality improvement that we need to do on the unit. So changing, let's say, how we care for patients and so forth. My role is just really being involved in those type of projects, whether I'm leading the project or just supporting, the staff that's actually leading that project. And then in addition to that, I do collaborate with various team members. So again, I do work in a very team-based environment. So I'm collaborating with my other nurse educators, like I mentioned already, the interprofessional team. We have a large interprofessional team within our organization. So again, like our pharmacist, dietitian. I also collaborate with other leaders on the leadership team. So this would be unit managers in the departments that I work in, directors on different levels, especially directors of professional practice. Again, my role is closely aligned to professional practice. So I do work closely with leaders that are aligned with this type of work. Right. The week in the life of my work is very interesting. What I love about my job, every work week is very, very different for me. And I think this is what keeps things quite exciting. I never have a work week that's the same. So just to kind of go through what my work week typically might look like. So because I'm part of the leadership team, I kind of work like business hours. So I'm usually at work Monday to Friday, your regular business hours. But my hours, they vary quite a bit. I could work like a 7 to 3, 8 to 4, 9 to 5, just depending what I'm required to do for the day. Something unique with my role. So I'm not as an educator. What I love, yes, I am supporting nurses, but I'm also kind of like all over the place. So I could be in one of 3 places. So I could be on the unit interacting with staff on the inpatient unit where we're taking care of patients, or I could just be in the building, but doing education, again, delivering education to different health professions group, is particularly nursing groups, or I could be on one of the UHN's sites. So I could be at another hospital, again, engaging in a lot of education to staff or attending meetings and so forth. So this variety in terms of like my environmental, where I'm situated, it's quite interesting because again, I'm not always in the same place every day. And I think that does bring a bit of like, excitement to my work because I get to be in many places, engage with different team members and, get the work done. Again, as an educator, a bulk of my work is to actually provide formal education to staff. So like from the pictures off to the right, so these are the pictures sort of to the left of the PowerPoint. So these are some pictures I captured in some of the education days. So you can kind of think of me as like a teacher. So I am kind of like in the front of the classroom, delivering education to staff. And this type of engagement varies. So it could be new nurse hires, it could be nurses with experience. We cover various topics. Again, the whole goal is to continue improving practice at the bedside. So the education is not just for new staff. I do educate various groups day to day. Like I already mentioned, I do a lot of supporting of staff at the bedside. So I actually really enjoy this because as a nurse educator, I'm actually not working at the bedside all the time, but I do get called to the bedside to support staff. So things that I might do, as an example, I might be called into the patient's room to put an IV in because that patient has a very difficult veins to access. So that really helps me keep up with my clinical skills. Or there could be a patient on the unit who's deteriorating, or we have some type of code on the unit, like a code blue where a patient is deteriorating. So I can actually be actively involved in this process and then just kind of like directing staff as to what to do, just providing that support. And I do a lot of like in-servicing on the unit. So this is like informal education that I provide to staff in the moment learning. Let's say if they have a patient with a specific condition, or some type of device that they need to manage, they don't have the experience, the competency. My role is to jump in and support that stuff. In addition to that, I do attend various meetings. So as you can imagine, as a nurse educator, again, I'm engaging in various activities on many different levels. So I attend quite a number of meetings that I sit on as a committee member. So things like reviewing our policies in the hospital, anything that the organization is prioritizing. So as an example, we could be talking about how nurses should be giving reports at the end of shift. So any of those priorities that the organization is putting forward, my role is to, again, actively participate in these meetings and then bring that information back to the unit and then be able to share that information with my staff and try to translate that information into practice. Okay. On a personal level, I do, my work life involves obviously not just work, but my personal life does involve me kind of balancing my work and home life. So I am a working mom, mom of one, soon to be a mom of two, and just finding that balance between, work and home life. But I do try to find quality time to spend with my family and do the hobbies that we love to do. Why did I choose nursing? Again, I'm very, very passionate about nursing, and I'm very fortunate that I actually ended up, in this career, in this line of work. Thanks to my mother, who's also a nurse. She's a role model to me, and over the years, she's spoken quite passionately about what she does. I did get the opportunity to actually shadow her at work. She works on a specialized behavioral support unit, and she's gone through extensive training. So she's really passionate about supporting the elderly population that has behavioral needs, where they support them with medication and just kind of redirecting them. And I also find that nursing nicely aligns with my passion to just be a very compassionate and caring person, which kind of reflects my personality. In addition to that, I was able to kind of build on to what I love. So I love nursing, but in addition to that, I love to teach. So I'm very fortunate that I was able to actually go back to school, go through the graduate program, and enroll into this master's program where I gained lots of knowledge on how to actually become an educator. So I really love, engaging with different team members, especially nursing, and just really shaping their mind, their practice. Because again, whoever we're teaching today will be caring for us tomorrow. And I think this all kind of came from me having like a great nursing career pathway. So from the time I was a nursing student, I had the most amazing teachers and educators that supported me along the way. And that really ignited this passion to do the same for the next generation of nurses. And my future goal is to continue pursuing this educator role. Again, I really enjoy what I do day to day. And down the line, if there's any other leadership roles that come up, I'll be more than excited to tap into those. So just a key thing to highlight, I think nursing is the work of the heart. And I do say this only because yes, there's skills that you need, how to insert an IV, how to take the blood pressure. But I think when you're dealing with individuals, especially after going through the pandemic, some of the nurses who stayed in the profession, they really cared about what they were doing. Like they were working from the heart, not just because they were nurses. Like it did take a special type of person to stay within that nursing field. And one of my educator philosophies, so educating the mind without educating the heart is no education at all. So again, nursing is a profession that does take some type of passion and heart to care for people, because it's so challenging, it's so difficult. It's not just, it doesn't come down to skills. It really does take that passion to see who you're caring for. You're dealing with an individual, like, and our patients have their family members, they have the loved ones who's quite concerned about them. So it really takes the courage to kind of step in the situation and be able to support that person, not just medically, but emotionally, and just making sure that they're well taken care of as a whole person versus just treating the disease. And that's it for me.
Good afternoon, everyone. My name is Michael. I'm a registered nurse here at Toronto General Hospital. I currently work in an amazing unit called the Medical Day Unit within the hospital. And my credentials is that I have my Bachelor's of Science in Nursing. So a little bit about myself. So I was born and raised in downtown Toronto. So I've been nursing for only 7 years, so I'm still a little bit of a junior-ish. I've worked 5 years at 5 years at Mount Sinai Hospital in a surgical oncology unit, and I recently started at Toronto General Hospital with the UHN family for a bit over 2 years now. So a couple of things that I like to do on my spare time include singing, traveling, hiking, going on a lot of food adventures, and playing a lot of video and board games. So recently, I actually took on a little hobby of joining a LGBTQ choir over here, and this was one of my holiday concerts, my first one, and it was amazing. And this one here, like Sharon, I also went to Mexico back in February, and I treated my mom for her birthday, and I took her and my brother out, and yeah, we had an amazing time. So regarding education, so again, like I said before, I have my Bachelor's of Science in Nursing. I started nursing school back in 2012 and graduated with my degree back in 2016 at Ryerson, formerly known as, and now known as Toronto Metropolitan University. And that's me. Okay, so topic of work. So my medical day unit, it's an outpatient clinic. So we admit and care for patients receiving treatments and procedures. So we're mainly an infusion clinic. So we administer blood and blood products, IV antibiotics, iron infusions, and we do a couple of procedures too, known as paracentesis and phlebotomies. The main thing that we do here is insert and maintain peripheral IV lines. We educate patients on their treatments. So for example, the reason why they're getting it and some things to look out for during and after their treatments. And then once everything is completed and we deem them as stable to go home, we discharge patients back home or the facility that they came from, or in some cases, we transfer them to the emergency department. So in a week in the life, so usually every medical day unit, we're a Monday to Friday clinic. So I usually wake up in the morning, have my coffee and get ready to work. So at the time that we start at 8 o'clock. So we admit patients right away, make sure they're taken care of, insert their IVs, educate them on the type of treatment that they're getting and some complications to look out for during the procedure or treatment. And then also at 9 o'clock, we also attend these team huddles in which we discuss ways to improve patient care, manage time efficiently, and promote a healthy, safe, and fun working environment. And then throughout the day, we care, monitor patients, we admit patients throughout the day. And on Fridays, we have what's known as our education days, in which we discuss new procedures and treatments being introduced to the unit, expand our knowledge and understanding on the diseases of the patient population, and honestly, anything that we'd like to learn more about. So the importance of nursing. So the importance of the medical day unit at my job here is to treat and manage diseases to allow patients to live their lives. So the number one thing I always tell myself, my colleagues, and the patients is that these patients don't ask to be sick, and they never ask to come to the hospital. So the best thing that you can do for them is, ensure that their stay is great, give them the best optimal care that you can for them, and just treat them like human, because that's who they are initially. And why nursing? Why not? Honestly, nursing is an amazing profession. You get to be on the front line. You help those in need, especially those who don't know how to help themselves. You make them feel better, and usually for me, my personal thing is if I make people feel good, I also feel good. So, and nursing is so dynamic. You can do so much with nursing. Um, you can be an educator, an acute practice, a practice nurse educator, a instructor. You can teach if you'd like. You can be a manager, a leader. You know, the possibilities are endless. And before I hand it off to my next colleague here, I'd like to leave you guys with this quote that I always live by ever since the start of my nursing career. So this is by Maya Angelou. They may forget your name, but they will never forget how you made them feel. Thank you.
So good afternoon, everyone. My name is Alexia Kumal. I am a research trainee at the Kite Research Institute here at Toronto Rehab, which is a part of the UHN family. I'm also a PhD candidate in nursing at the University of Toronto. And my third role is a registered nurse at Mount Sinai Hospital. So I work on the General Internal Medicine Unit, 10 North, and I've been working there for a bit over 10 years now. Okay, so just in terms of a little bit of background about me, so I was born in the Philippines and I came to Toronto as a small child. In terms of things I like to do, I really like organizing things. I just bought a couple carts from Wayfair, and I'm going to be organizing some stuff maybe later today. Uh, I like listening to music. It really helps me to relax and just, feel good. And recently, I kind of go monthly. I go to the Claw and win a bunch of stuffies. And so you can see there a picture of me with a bunny. It's a lot of fun. It's actually also really stress relieving too. So in terms of when I joined the UHN family, I joined in 2019 on the Enhancing the Care of the Older Adult research team with Dr. Kathy McGilton. It's an excellent team. We work on doing research that aims to improve outcomes for older adults. And that's the primary area of population in my clinical work as well. So it's a really great way to mix everything together. So in terms of education, so for me, when I came out of high school, I wasn't 100% sure what I wanted to do. And so I did a general honors Bachelor of Science degree at U of T. And so for this degree, I did a major in human biology, a minor in sociology, and a minor in Latin. Yeah, very different areas, but I loved all of them, especially Latin, actually. It was actually a lot of fun to learn that. And so during my undergrad, I had the opportunity to volunteer at Mount Sinai Hospital on 12 South. So that's a general internal medicine unit where you see every different type of patient and you learn a lot. It's a very fun environment. And I got the opportunity and privilege to shadow a couple of really amazing nurses. And that really, I was like, I want to be just like them. And so I applied for the Bachelor of Science program at U of T as well. And so this program is a 2-year accelerated program. And I graduated in 2012. So after I graduated, I went to Mount Sinai Hospital again. And I've been working there since 2013 when I started. And I still work there now, albeit casually because now I'm back in school, but I still like to work. I very much enjoy my shifts when I'm there. And kind of like Michael, I love making a difference in patients' lives. And when they're happy, I'm happy, and vice versa. So it's really great. After about 4 years or so of working as a nurse, I applied for my Master of Nursing program and started in 2017. And so I really love clinical practice. I love working with patients. And so my area of focus within the master's program was the clinical nursing field of study. And so for that program, it was 2 years, so I finished in 2019. And during my master's program, I met who is my current now PhD supervisor, Dr. Kathy McGilton, and this was I think the beginning of second year, pardon me. And I remember seeing her. So she's a professor, she is a researcher, she's amazing. And I thought, oh my goodness, I want to be just like her. And so I applied in the second year of my master's program for the PhD program. And I'm going to tell you a story now and in hopes that it might encourage you. So when I applied for that PhD program in my second year of my master's program, I actually did not get in. And so the first time around, so I was, of course, I was a little sad and maybe mildly devastated initially, but I worked really, really hard that year. So I did a lot of research work. I helped my supervisor with a lot of projects. It was really fun. I met a lot of people, got to collaborate, worked really hard, still worked as a nurse as well. So kept my practice, got to work closely with patients, of course, in care. And so I applied again the second time and I was able to be successful the second time. So if you apply for anything, if you do anything and you don't get it the first time, don't worry, just try again the next time. So currently I'm in my fourth year of the program, so I'm a PhD candidate, and that means that I've defended my PhD project proposal. So within the picture there, you can see that's me at my defense. I was very happy because it was a bit of a stressful process, a little bit, but I was able to pass the defense last May. And so right now I'll talk about a bit more about my project in the next couple of slides. So in terms of topic of work, so I love the area of older adults, care, health outcomes. And so both in my clinical practice as well as in my research. So the aim of my research is to improve outcomes for older adults. And in practice, I really love working with people with cognitive impairments, such as dementia. And so I also really like to focus on this area of research as well. And so that takes me to my PhD project. So for my project, I am currently conducting a nurse-led mobility intervention for older adults with cognitive impairment. And so the mobility intervention, I'll discuss actually in the next slide, but it involves walking, sit-to-stand activity, and it also involves speaking with the patients. So it's not just so boring. You're not just walking, you're actually talking with them as well. And it's a great project. I'm having a lot of fun with it so far. And so the research questions for my study. So first, I want to know, is a nurse-led mobility intervention doable? So is it feasible? Can it work, in a potentially different setting as well? The second question for my research study is, are older adults with cognitive impairment satisfied with the intervention? Meaning, do they even like it? Is it worth doing again in another study, in a larger study? And then the third question for my research is, does it improve outcomes? So I'm trying to see whether this type of intervention will improve walking ability to perform activities of daily living, like, transferring from bed to a chair, being able to eat by yourself, go to the washroom on your own, things like that, various activities of daily living. And as well to see if this intervention will improve quality of life. So these are the outcomes that I'm looking at for my project. So what's a week in the life of someone like myself? So currently, the week in the life has changed over the course of the 4 years, depending on which year I was in. If you had asked me in first year, I would have been in a lot of coursework. But currently, because I'm in fourth year, I'm in data collection and intervention delivery. So for my study currently, I go on site 5 days a week. So I have 2 study sites. One of them is in Scarborough, one of them is in Pickering. And so I get to work with patients from there. So I get to conduct the intervention. So as I mentioned earlier, so I walk with the patients, I assist them to perform sit-to-stand activity. And this type of activity has been shown in the literature to help improve muscle strength within their legs, because a lot of patients, when they've come from the hospital, their muscle strength in their legs gets a little bit weaker because they're not walking as much. And then also I talk with them. So, it's not very boring. Actually, I'm getting to know my patients well. They like talking with me and vice versa. And so it helps make the intervention just a lot more enjoyable for them. Other things that I do as part of my study. So I describe my study in detail to patients and families who are interested in it. And I stay and answer any questions that they might have. I also obtain informed consent. So that means that I would have explained the study very well to them. I would have answered all of their questions and they have no concerns and they've agreed to participate in my study. And we sign the forms and then we carry on with the study. As well, I get to conduct interviews as part of the study with patients and family members. These interviews help me to get to know the patient better prior to the actual walking sessions. And one part that I really love, so I enjoy teaching, kind of like Sharon as well. I enjoy teaching, and so I train, teach, support the research assistants who are helping me on my project. And so that's really, fulfilling part of my role as well. Other parts that I do during the week, so I attend team or project meetings, and so I meet with my supervisor and her team every so often, and also I've helped her with her project as well. So we attend project meetings to see, troubleshoot, discuss any concerns we might have, things like that. In other words, it's never boring, so it's really great. There's lots of stuff going on. And as for me, so I get a lot of fulfillment from helping others, from being involved in many different ways, like extracurricular type of activities. So currently, I'm involved in committee and volunteer work. So the Graduate Nurses Student Society is a society that helps, it's kind of like student government for the PhD program and the master's program. So I'm currently the year 4 representative. And so I get to bring any questions and concerns that my classmates have to the society, and they can bring it up to the faculty as well. And then also, so Kite Tech is the Kite Executive Committee for trainees who, like PhD students, master's students, who are at the University Health Network, specifically Kite Research Institute. So I'm an events team member, so I help to plan events for trainees. And then, so I mentioned I'm a casual nurse, and I would love to work more, but I just don't have the time at the moment. But I do work a nursing shift at the hospital and love every minute that I'm there. So, why did I choose this career and why is it important? Well, I love this career. I love nursing. So and what's perfect for me, because nursing involves a lot of talking with and engaging with people, and so does research actually. So it's great. And I love being able to make a difference in people's lives. So as a nurse, immediately I can make a difference. It's like, even when you're giving medications, it's not just giving medications. You're like, okay, so this is your amlodipine. This is a blood pressure medication. You give them, okay, would you like to take it with this water? Like it's not just giving medication. It's not just, talking with them. It's the manner that in which you engage with the patients. You can make such a difference as a nurse. Every little interaction, you can make a patient smile who was otherwise very sad earlier in the day. So nursing is wonderful that way. So you can make an immediate difference each day. And then also in the long term, so as a PhD candidate and a researcher, the research that I'm conducting and that I'm helping with my supervisor as well, these all aim to improve outcomes for patients in the future. So I get to do that as well. So it's really fun. As a person, I'm detail oriented, and that aligns very well with research, because research is very detail driven in a sense, or being detail oriented is very helpful to do research well. And then finally, I'm a people person. I'm enthusiastic, I'm cheery. So being a nurse and researcher allows me to interact with people and engage with them in a meaningful way. So I hope this helps to show you different options for nursing, and do consider it. Thank you.
Thank you, Alexia. That was great, and so cool to hear from someone who's doing nursing and research. So we are now going to start our Q&A portion of the event, and I'm just going to spotlight our speakers here for everyone. And there we go. So if you have any questions for Sharon, Alexia, Michael, or about nursing in general, feel free to put them in the chat, or you can also use the raise hand feature and we'll call on you to unmute yourself. While we give students a chance to kind of think about what their first question might be, I'm just going to start off with one of the registration questions I saw. So the students are kind of wondering, you all have different nursing careers. How did you choose what specialty? How did you choose what area of nursing was for you? Maybe in order of panelists, Sharon, do you want to take that first?
Yeah, that's a great question. And to Michael's point, nursing, you have so many avenues that you can go down, and it can be very challenging to come to a decision. So when I started off my nursing career, I was actually part of the float team. So I was a floating nurse, and I was actually working between Toronto Western and Toronto General Hospital. And I was floating to different inpatient areas, so medicine, surgery. So I was pretty fortunate enough to be able to actually experience different type of nursing, like different patient populations within this role. I just fell in love with surgery. Mainly because patients come in, we know kind of like what's happening with the patient. We have a good plan, like, let's say if they come in with a fracture, we're going to take them to surgery, we're going to fix them up, and then we're going to send them to the next place. So whether it's rehab or going home. So with with surgery, I kind of liked how the trajectory for the most part is short. You come, you help the patient, and they move on to the next thing, which is a little bit different for other units, let's say the medicine inpatient units, where sometimes you just kind of figure out what's happening with the patient, and they might be there for a long time. So for me, again, I was just fortunate enough to be exposed to these different areas. And then again, just being able to build on my passion of teaching. So being a nurse educator came naturally because, again, I've had amazing teachers, educators during the course of my nursing student life. And as a nurse, and I just aspired to be just like them. Yeah. So that's how I kind of end up as a nurse educator and in surgery at the same time.
Michael, did you want to add on to that?
Yeah, so I got into medical day unit after Mount Sinai. So I worked at Mount Sinai for about 5 years, working surgical oncology. So during that time, I was able to develop my clinical skills and also a lot of critical thinking during that time. Because we're dealing with acute patients after surgery, so anything can go wrong after surgery. So after getting experience and working with such a wonderful team, I decided to try something new because why not? Sometimes you get tired or sometimes you just want to try something different, just, for excitement, for fun, something challenging. So I decided to apply to UHN and I saw a position for medical day unit. And it was different from an inpatient unit because it's considered an outpatient clinic. So we work Monday to Fridays. So it was a complete 180 for a lifestyle going from working 12-hour shifts to working Monday to Friday, 8 hours. And yeah, honestly, I really enjoy and love working where I do right now. I shout out to my amazing coworkers and other interprofessional team members I work with because they make working there every day not even feel like work. It honestly feels like a hobby. It's honestly so fun.
That's great. Alexia, I saw you smiling and nodding along. Did you want to add to that?
Yeah, for sure. It's so nice to hear that you love working there. Yeah, absolutely. It's yeah, I love working where I work as well. So for me, I discovered that I really like general internal medicine during my nursing school. So in nursing school, you do, at least depending on the school, you do a number of placements in various areas, maternity, mental health, etc. And when I went to general internal medicine, it just clicked. I was like, yes, this is for me. And I really like working with older adults. Like the patients that I had were pretty much older adults, and I love working with them. So it was a logical choice, and I've continued working there ever since.
I see a lot of chat questions coming in, so I'm going to get to those next. Someone is asking, if you were in their shoes as a high school student, what do you wish that you knew before deciding to pursue nursing, or what advice would you give them? I'll let whoever feels ready first take that one.
Let's see. I can go first, maybe. I I found out about nursing. Honestly, going into the profession about nursing, I didn't really have direction. I was more so influenced by my mom, who she's not a nurse, but she has family members who are in the healthcare field. So she encouraged me to pursue nursing. And so I did. But the number one thing I would probably like to know during high school would probably be that it is a lot of work. It's going to be a lot of work physically, mentally, but you know what? At the end of it, it is very rewarding because you're, again, like Alexia said during her presentation, that you are making a difference and a positive change in people's lives. And it's honestly it's the best feeling that you can have. So that's the number one thing. It's going to be a lot of work, but once you put in the work and effort, it's going to count. It's going to count at the end.
I think that's beautiful. We just had Mother's Day, and Sharon also mentioned her mom, so that's great. Did either of you, Alexia or Sharon, want to add on to that?
Yeah, I can just briefly mention for what was helpful for me at least was knowing, I guess, what nursing was like. So for me, it would really help to volunteer and get to shadow a nurse. Maybe that if you're not 100% sure, maybe, volunteering, shadowing, asking to shadow a nurse or two. So you kind of see what the role might entail and see if it's for you. Yeah.
Thank you. And I see a question here. As a fresh grad or new grad, do all nurses need to go to a hospital and do clinical bedside work? Sharon, do you want to take that one?
Yeah, so just to recap the question, as a new grad, does the nurse have to work in a hospital setting?
Yes, and then do
Okay, yeah. So not necessarily, no. So like we already mentioned, so nursing has a wide variety of settings that you can work in. Hospitals are just kind of like by default, everybody knows that when you go to a hospital, you find nurses. But there's some cool areas that you can work in. So things like working in clinics. So you could even work, let's say, at a physician's office, like a family doctor's office, as an example. You can work in clinics. There's other settings that are not so, as a new grad, might be challenging, but there are options maybe further down the line. So I have friends who work, let's say, in forensics. They work in informatics. You can even work in the like the jail system, as an example. So like there's different, and when you actually go through nursing education, there will go through some of the options in terms of like the work setting that you can work in. The hospital setting is just nicer because it's a bigger team. You have lots of support, lots of exposure to different skills, but by no means are you just limited to working in a hospital setting. There's tons of options out there. Travel nursing is pretty cool. It's very attractive for young people coming right out of school. So if you love traveling like myself, you could travel and also do what you love at the same time.
Thank you, Sharon. And this question maybe Michael can take. What made you opt out of working 12-hour shifts and instead choose to do Monday to Friday?
I think it just came with the job. That was just the hours that was planned out for the job. But honestly, I working in the 12-hour shifts, yeah, it is a lot physically because you're basically working the whole day and then you just go home to sleep and then back to work. But mind you, it is only for 3 to 4 days and you have a long period of time off. But sometimes for me, it was more so a majority of my friends were working the usual 9 to 5 gigs kind of thing. So in order for me to align my social life with theirs, I saw that this opportunity came up and I got it. Yeah, so I like working the 9 to 5. You know, you can have a social life, but even if you're working shift work for 12 hours, you can still have a life.
And as a friend on the other side, I think friends appreciate nursing schedules can be challenging. Maybe Alexia, you can take this one. So someone's asking, where are some places that students could possibly volunteer to gain nursing experience? And they're asking specifically age 14. So just to clarify first, oftentimes if you want to volunteer in clinical settings, like at the hospital, long-term care, you do have to be 16 plus. So keeping that in mind for grade 9 and 10s, do you have any suggestions?
Oh, I did not know that. Okay, that's good to know. Well, I mean, it was, I'm not going to say how many years ago this was, but a long time ago when I was in high school, I also did volunteer at Trillium Health Center on the Queensway. It was a little like there, and I'm pretty sure I was younger than 16, I think. Anyways, but there was a complex continuing care unit there where I got to help, with like various little activities. Um, so that's one place that um, could be useful. What about nurse? I'm not actually sure because I don't work in a nursing home setting, but I don't actually know.
Hopefully 16
Is it
plus.
still 16? Okay. You know what? Let me think about it as well, but that's it so far. Thank you.
No problem. Sharon or Michael, any ideas or do you want to add on? I know it's harder when you're under 16. I would say, first of all, for high school students, when you turn 16, yes, you can definitely sign up at nursing homes, hospitals, etc. If you're not yet 16, think about what is attracting you to nursing. Is it the idea of helping other people, maybe caregiving? Because in that sense, you could kind of just volunteer anywhere. You could try volunteering at a community center where you might be working with a certain population, whether it's older adults or children. And then if that's what you need to do with your nursing license, that's an option. So keep that in mind. I'm going to move on to our next question. I see someone asking about schools and programs. How do you know which one's the best? Do any of you have any advice for students maybe deciding where to go to study nursing?
I could comment. I mean, based on my sort of like experience and kind of like, because sometimes I sit on the hiring panel where we look at hiring nurses into the organization. So you definitely want to go with a recognized school, right? So try to avoid those private colleges where we just don't know what their standards of education for nursing are. So if you kind of stay to the mainstream institutions or like educational programs, like if you go through, let's say, for the undergraduate program, it could be, again, like already mentioned, the TMU, York University. So some of the recognized names, right away, we are confident that you received the proper education. If you then go through some of the private colleges, we're a little bit hesitant because, again, we just don't know what standard of education you received at that college. So try to keep it mainstream. Any recognizable name, for the most part, you're pretty safe. But definitely stay away from private colleges because their education is not regulated. Like what education they deliver to nurses might not necessarily align with, like the College of Nurses expectations as well as the hospital's expectations.
I think that kind of brings us as students asking similar questions. So what is the difference between going to college or university for nursing, maybe?
Maybe I can answer that question. So in order to be a registered nurse, you do need an undergraduate education. So you actually have to go through a university. In my case, I went through a university, but I started off at George Brown. The program they were offering was offered at 3 sites, so Centennial College, George Brown, and at Ryerson. So we had an option to go through a college for the first 2 years and then transition to, formerly known as Ryerson, but TMU now, for the remainder of the 2 years. But the education that was delivered at the college setting and the university setting was all the same. So if you want to be a registered nurse, you are required to go through a university program. If you go through a college program, it's going to be a 2-year program, and this is where you're going to be a registered practical nurse. So examples of schools that offer that program would be George Brown College, Seneca, and so forth. So if you want to be a registered nurse where your scope of practice is much more extensive compared to a registered practical nurse, then it's a university education versus the 2-year program, which is for RPNs.
Thank you, Sharon. I see a question here, maybe Michael, you can take this one next. As nurses, how do you deal with challenging situations? And at the end of the day, how do you manage to cope if you've had a particularly hard day or a difficult day?
That's a really good question, actually, because sometimes work as a nurse could be different. It could be challenging. It could be exciting. It could be, it's like a box of chocolates. You never know what you're going to get. But some days when I'm feeling stressed at work or if something is too overwhelming, usually you just go off to the side, just de-stress, or sometimes you have your colleagues are also there to look after you just to make sure everything's okay. And then also making time for yourself, As nurses, it's a stereotype, but it's a stereotype for nursing in general that we always put others before ourselves. And that's something that I learned that as a nurse, that you need to put yourself first so that you can take care of others. So just putting yourself first, making sure you have time to do things that you love to do so that your mental health isn't diminishing, but it's thriving. So always put yourself first, make time for yourself, and go out, have fun,
Thank you, Michael. I see a chat question here. When applying into second entry nursing programs, aside from academics, do you think supplementary applications or volunteer experience matters? Is anyone able to answer that? Or maybe Alexia, I know you've applied to a couple programs.
Yes, thanks for the question. So I can speak to U of T's application, but again, I'm dating myself. This was like 10 years back. So the application might have been a little bit different, but absolutely. So yes, I think the question is like grades versus extracurricular. So both matter. So yes, decent grades, but at least at U of T, they're looking for a lot of things like leadership and how do you contribute to the community, things like that. So that's why opportunities such as volunteering can be very helpful. And as well, so volunteering doesn't necessarily, if you know you're into nursing, let's say if you like nursing, your volunteering doesn't necessarily have to be in the healthcare sector. It could be things that you're passionate about. And a lot of those skills, leadership, those are transferable to nursing as well.
Thanks, Alexia. I have a pre-submitted question here. Someone asked when they signed up, how was the transition from school to actually practicing as a nurse? To each, if you want to answer how that went for you. Maybe Sharon, you can go first. I see you laughing.
That's a very good question. Yes, so the transition to practice is always very interesting. In my experience, I was pretty fortunate enough to have, I'll say, majority of my clinical placements at UHN. So when I transitioned from a student to a staff member, I was already sort of like socialized to the UHN work environment. I had kind of, worked on various units, so I was pretty comfortable. So the transition for myself, again, in this particular instance, was a bit smoother. However, there's always kind of like, theory and practice, there's always a disconnect, right? So what you idealize nursing to be and when you actually become a nurse, sometimes there's a bit of a disconnect. But again, I was just fortunate enough to have very supportive coworkers, manager. So just leaning on my colleagues if I'm having a rough day, because you start off the day thinking everything's going to go well, and then you have a patient that goes sour, things go downhill, and you just feel a little bit overwhelmed and that moral distress, like I could have done more. So back to Michael's point, you always have to kind of take care of yourself because, again, ideally the days should go well, but in nursing, when you're dealing with humans, you never know what happens, right? Like every day can throw something new at you. So you have to have like a good backbone and a good support. So just the one biggest thing I recommend, because again, and also working with different team members, that can take a lot. And anyone can appreciate how team dynamics can be very interesting. So just putting yourself in that equation can be very challenging. But again, I think at the end of the day, just having a supportive team, having a supportive, group of friends, family members at home goes a long way, because there will be days where you come home, you just want to vent. But once you vent, you can take a nice shower and relax. And then you just have to return back to work the next day and carry on, right? So just having a good support system goes a long way, because the workforce is very challenging. And just speaking about the COVID pandemic, we saw lots of people leaving the profession because it was tough, right? But a lot of us stayed behind because, again, we just had the passion and there was something that was driving us to carry on. But yeah, that's my take on it.
I think that's a great take. Michael, what about you? How was the transition from school to practice?
Okay, so the transition from school as a new grad to the working environment was I'm not gonna lie, it's very challenging because as a new grad nurse, you're so excited, but you're also so anxious, you're scared, you don't want to mess up. Plus, you're dealing with people's lives, right? You want to make sure that their care is optimal the best way that you can. The most challenging thing for me was probably time management. I remember when I first started nursing, for the first couple of months, I always stayed after hours just to catch up on charting, making sure I documented everything correctly, got people's names right, making sure that my patients were settled and stable for the oncoming nurses. And also just a lot of, like Sharon said, a lot of that can be uplifted with a good support system. So I was very fortunate to work with such amazing nurses in the past and currently, because it's all about teamwork. Teamwork makes the dream work. And it's not just nurses as well, but also every single member of the interdisciplinary team. Their number one goal is to ensure patient safety. So all of our end goal is the same. We just all have to work together and make sure that the outcome is good.
Thanks, Michael. And what about you, Alexia? How was your transition from nursing to practice or school to nursing?
Yes, so similar to Michael, I also had it was a bit challenging for me as well. I also struggled with time management and I was very anxious. Someone once called me a little ball of anxiety. That being said, it's because kind of like, as Sharon and Michael have said, you want to do the best for your patient. And I had this like high expectation of myself to be able to do X, Y, Z right at the beginning. But no, it takes time to learn a lot of these skills. And similar to Michael, I had very good colleagues and very good mentors that really helped me to just feel more comfortable in my own skin and just transition, in time to be a confident practitioner.
Thanks, Lexi. I know we're running out of time. We have 4 more minutes. Maybe someone can quickly answer to what are some 2 main pros and 2 main cons to working as a nurse? And I think this is going to be different for everyone.
I can go first. Lots of pros of being a nurse. In my particular experience, it's just the diversity. Like, I went back to school, did my graduate education, and when I came out of that education, I was like, oh wow, I can do so many different types of nursing positions. So I just like the diversity that it offers. And again, not to oversell travel, you can work as a nurse in any country in the world. So if I decided to, pick up my family and move to a different country, I could easily, find another nursing job in that area. Cons, things we already talked about. It's a very challenging profession. It does take a toll on your mental, physical, emotional being. But again, that just comes with just being able to recognize that and take good care of yourself, because you are caring for people. So you want to make sure that you don't always bring that emotional sort of baggage home with you and then put that on your family and whatnot. So just being able to kind of disconnect the two sometimes is good, so that when you come home, you're still there, you're present with your family, with your friends. Another con, yeah, I think I'm going to pass it along to other people to comment.
Okay, let's see. I don't really have much of cons besides, yeah, it does take a physical, emotional, and mental hit on you. So all you have to do is really take care of yourself and just, cope the best that you can. But a pro, again, it's a very rewarding job because you're doing the best for someone who can't do the best for themselves. So you're just helping them along the way, kind of thing. So it's very rewarding just helping, and I don't know, I like helping people, so why not?
Yeah, I wrote down when you asked the question, my top pro was so rewarding. Michael, you and I are thinking the same way today. It's awesome. And it's the most rewarding job, honestly. I can't say that enough. And similar to Sharon, there's just so much room for growth. So you can do so many things, and I'm able now to do a study that's nurse led. So that's very exciting. So you can do so many things with nursing. And in terms of cons, there's not that many. Emotionally challenging, yes. And exactly, self-care, like my colleagues have said. And sometimes, a patient or a family member might say something to you that might be, kind of hit you hard. But honestly, don't take it personally, because it's not you, it's the situation that they're in. We'll learn to be empathetic, be present with them, and, just talk to your colleagues to help support you when you have challenging situations.
Thank you, Alexia. I think that's a great piece of advice to end on. So it is 5:59. I'm going to launch our exit poll and then slowly get started with our wrap-up slides here. So you should hopefully all see a window pop up separately just to kind of get your feedback on how you feel about today's event. So thank you so much to our panelists. Let's start there. Last week was National Nursing Week. So this year's theme, I think it was changing lives, and definitely our 3 nurses here today have changed many lives, and we're so grateful to them for taking time out of their nursing careers to join us for today's panel. If you're interested in learning about more STEM careers or more opportunities at UHN, our team is UHN STEM Pathways. We have a free youth outreach program where we do events like today's. We're virtual or in person as well, and you can find all the information about what we offer on our website. And if you're interested in learning more about nursing specifically, we've actually hosted multiple career panels that involve nurses from the University Health Network. So I put a QR code on the screen. You can scan that and it'll lead you right to a YouTube playlist that links all of these panels featuring different UHN nurses.